Interoperative neurophysiological monitoring, also known as neuromonitoring, is a simple yet a critical procedure designed to detect and prevent potential damage to the nervous system during high-risk surgeries. It involves continuous monitoring of muscle, nerve, brain, and spinal cord functions during a wide range of surgical procedures.
Any surgery where the neuromuscular system is at risk should be monitored by intraoperative neurophysiological monitoring. If the surgery is not monitored, there is a potential for major neurological injury resulting in some sort of disability for the patient.
In certain procedures, it's very important that we monitor the nerve function both from a sensory standpoint, a motor standpoint, and to see if the nerve's being irritated by the procedure we're doing. If there's a change during the procedure, we can change what we're doing. We'll know right away. We don't have to wait for the patient to wake up to let us know that something's wrong.
Neuromonitoring has become a routine part of many surgical procedures. It prevents injury, protects patients, and reduces physician liability while bringing down the skyrocketing healthcare costs. As a result, it's beneficial to patients, surgeons, and hospitals.
If the surgery is monitored by a team like Neuro Alert, the chances of major neurological injury is reduced to 0.1% as opposed to those unmonitored cases, which can be as high as 4%.
Any element of security that I can add to the case is of tremendous value to me and the patients. And specifically neuromonitoring as what I think is becoming the standard of care for many procedures, and something that for a lot of procedures I would never operate without.
It has saved a few of my patients. I use it on every one of my complex scoliosis, reconstructive, and cervical spine cases. And I think it's absolutely mandatory to do so.
Here's how the process works. A highly trained and certified neurophysiological technologist assigned to the case is working right there on site in the operating room, carefully monitoring, evaluating, and coordinating the entire procedure from start to finish with a remotely based physician. They use sophisticated technology to continuously track and identify changes to the nervous system and notify the surgical team of the findings, thereby minimizing or preventing any impeding damage to the nervous system.
It allows us to see activity or possible injury before it happens, warn the surgeon ahead of time so that he doesn't have to wait for the injury to or the damage to become permanent. He can see that something's going on as soon as it happens, and he can work to fix it or improve it before the patient even wakes up.
We are proud to have a team of physicians as well as very well-trained neurophysiology technologists who are very qualified to monitor any and all of the cases that require neurophysiological monitoring. We are unique in that we have developed unique processes and trained the technologists to meet any challenges that occur during the surgery.
Surgeons are more attuned to the necessity of having NIOM, not only from the liability aspect, but for the reassurance and for the best interest of the patient. The fact that it's become the state of the art, and it's essentially something that should be done with every operation with any possibility of neurological impairments.
I find that it adds an extra level of safety for my patients. It gives me a little bit more comfort level when I'm in the operating room and I'm working around the spinal cord and the nerve roots. And it gives me a better comfort level when I leave the operating room knowing that things started off normal and were normal again at the end when we finished.
It gives us confidence that when we're finished with the surgery, as long as there's been no change or even improvement in the neuromonitoring signals, we know we've done the job that we came to do.
Each life is precious. Each patient deserves the best possible care. Neuromonitoring is a crucial tool, allowing surgeons to optimize performance, avoid liability, and ensure safety of each patient who walks into the operating room.
One thing that we try to tell our technicians that go into the operating room is, when you walk out of that operating room, you need to feel a sense of pride because you potentially did something today that prevented a lifetime of injury and pain from a patient.
I have to know that the person in the corner of the room who's performing the neuromonitoring is both skillful and trustworthy. And one of the reasons that I like Neuro Alert is because they're both. My interaction with their technologists is reliable. The data that they give me is reliable, and it's one less thing on a list of 100 things at any given moment that I'm worrying about. It's one less thing that I have to worry about because the trust is there.
So to learn more about interoperative neurophysiological monitoring, please visit www.neuroalert.com or call 888-787-6267 today.